Dr. Bogoch, thank you so much for joining us on our health and wellness series. I think it's never been more important and more fitting than to speak to an infectious disease specialist as it is right now at this moment today. So much has gone on the last 24 hours, so much to get to. But the first question that I have for you, where do you feel we are in terms of flattening the curve right now today?
I mean, in Canada, I think we're doing pretty good. We certainly have seen cases plateau and even significantly decline in most parts of the country. There's provinces like BC and Alberta who definitely flattened the curve and are seeing low numbers of cases per day. Alberta's having a few outbreaks here and there. Other places, for example, the Maritimes are doing fantastic as well. Even Ontario, which was having trouble earlier on, they were seeing anywhere from 600 to 700 new cases per day, is now at around 300 to 400 new cases per day. So they're doing well. And really, the hotspots are Quebec and in particular Montreal. And I would still say the Greater Toronto area, they're seeing about 60% of all the cases in Ontario. So those two metropolis settings are kind of the hotspots in Canada. But elsewhere, I think the country's doing all right.
So it's been said that herd immunity is really the only option in getting over this. And so where do you see us getting there safely?
So, I mean, herd immunity actually can refer to a few different things. One is that, people get infected and hopefully they develop some form of immunity and hopefully that lasts for a period of time. So that's sort of one, we call that natural immunity. And then, when we really talk about herd immunity, we're often talking about vaccination. And, I really do see vaccination as the durable solution out of this mess we're in. Because, I don't think this virus is going to go anywhere anytime soon. And certainly we know the devastating toll it can take, especially on people with underlying medical conditions or people who are over the age of 60. So, I think it's great to see that there's just tremendous research going on to develop vaccines. There's over 90 different teams working on this front. And, people say it takes a long time to develop a vaccine, and they'd be right. But, I don't think we've ever seen anything like this before, where there's truly unlimited brain power and unlimited resources being poured into this. So I think I'm optimistic on this front. Some of these candidate vaccines are looking pretty good and they're pretty advanced. I mean, we're in phase 2 clinical trials for a couple of them. So that's impressive.
Incredible. It's actually incredible. So you're talking about the numbers throughout the country mostly are starting to decrease. So where do you feel we are going to be in the next month or so in regards to isolation and extreme measures? Because people are getting so many mixed messages. We had Dr. Fauci in the US yesterday saying that reopening various parts of society too soon, it's way too soon. And then you have other specialists talking about how we are creating other problems, staying isolated. We could talk about those problems in a moment, but where do you see us in the next couple of months?
Pardon me for 1 second. I'm sorry.
Yeah.
Can you hear me now?
Yeah.
Okay, I'm sorry. It just cut off for 1 second.
Yeah, so my
maybe
question was,
you can edit that part out, pardon me. But I heard most of it and then it cut out for a sec, so I apologize for that. But
so I'm going to ask you again, how much longer do you see us in isolation?
So
I'm sorry, I can't hear you. You cut it again.
Yeah.
Can you hear me now?
Now we can. Yeah, you're good.
I'm not sure. So we're gradually lifting the public health restrictions that we're living under. And certainly some parts of the country and certainly some parts of the world are further along than others as this epidemic has sort of taken its toll and the first wave has sort of petered out. And, it's interesting, in areas that are having low levels of transmission, I think it's completely reasonable for those areas to start to lift public health restrictions. But, some places may be lifting their public health restrictions a little bit too soon. And obviously the risk in those settings is that you're just going to get a rebound of cases and end up where you were in the first place and really have to clamp down harder with more public health restrictions for a longer period of time. I don't know if there's any, in the pre-vaccine era, I think it's going to be challenging. But certainly in many jurisdictions where there's a decreasing number of new cases per day, and this seems to be sustained over time, I think it is okay to slowly and cautiously lift these restrictions that people are living under. I just think the communication has to be key, where people are aware that, even with some of the lifting of these public health measures, if there are an unacceptable number of new cases of COVID-19, we might need to regress a little bit and climb back down. So communication is key. We're asking people to give up a lot. There's a lot of economic hardships, and it certainly is disrupting everyone's day-to-day lives in a tremendous manner. But on the other hand, look what happens when there aren't public health measures in place. I mean, the U.S. has seen about 80,000 deaths in about 2 months, and that's with public health restrictions in place. So this could be a lot worse. So, of course, it's balancing a tightrope. It really is balancing a tightrope here.
I think we've done a good job. I do. I think we've done a really good job. I think Canada is very different than the U.S. And I believe, through personal experience and research and speaking with people, that people were listening. They absolutely were listening.
I mean, now Canada certainly, go ahead.
Yeah, so now I feel like it's the second half of that. And what we're seeing now is the massive effects of isolation, and what may be our next big health crisis, which, of course, I know you're not a mental health expert, but it really is the next wave, is what it's doing to our mental health, and particularly our children and our youth. And so that's why, and our teens. And that's why I was asking you about how much longer do you foresee as an ID specialist, because our kids are having a very hard time, and knowing that there isn't an end in sight for them, they're having even a harder time with that. So that's why I was asking you about.
No, I completely agree. And I think a lot of this is going to be compounded by, other factors as well that are intimately related to this, like economic hardship and, uncertainty over the future, and, even things that just a combination of things that are affecting and impacting our day-to-day life, impacted supply chains, like you name it.
Yes.
Our day-to-day life as we know it has changed significantly.
Absolutely.
And the sad thing is there's no clear timeline for when things can and will go back to normal. And that's obviously taking a tremendous toll on mental health. And, one of the concerns is, of course, there's the infectious disease concern of a second wave, which, we're going to have one. It's just a matter of how bad is it going to be depending on the measures we take to mitigate that. But of course, the big concern is deaths of despair. And, what's going to happen with, anxiety, depression, lack of access to, social, normal social behavior, concerned with drugs of abuse, concerns with alcoholism. I mean, these are, going to be tremendous. It's going to take a tremendous toll, and
very serious.
Yeah. And economic hardships aren't going to help this whatsoever. So it's going to be a tough few years ahead, I think.
You talk about sort of the two hotspots in Canada being the two major urban centers, Montreal and Toronto. We talk about our kids, our teens, our youth, and that summer's coming up, and that a lot of kids get out of town in the summer. They go to overnight residential camps or various sports camps, and that's teetering right now. We don't know if our kids can do that. We haven't had the okay yet from government, or we haven't been told no either. But to me, it would seem safer to allow them to go to a safe environment where they've been tested before, right? As opposed to letting them roam free in the city where they're not being supervised because parents have to get back to work.
I don't know. Honestly, I think you could debate that. And, pros and cons of both. But, we know that kids, and let's say, I don't want to say kids and young adults, let's call it under 18. We know that they can get infected. Absolutely. Now, the younger people it looks like people may be less susceptible to getting this infection. But kids of all ages, from 0 to 18 can be infected. So that's point one. Point two is, what is the role that ages 0 to 18 are involved with transmitting the infection? Maybe the younger you are, the less likely you are to transmit the infection. Okay, maybe that's the case. We're not entirely sure, but that might be the case. But even if kids are less prone to getting infected and less likely to transmit infection, if you get a bunch of them together under one roof, you can certainly amplify this infection despite the inefficiencies of acquisition and transmission. And the concern in those settings, why aren't we all going back to school? Why aren't they going to summer camp? The concerns in those settings are if you amplify that under, one roof or in a summer camp or something like that, these kids go home. They infect their parents. Worse yet, they infect their grandparents or contribute to community spread. Now, of course, is there any right or wrong answer here? That would be unfortunate. But, having kids roam free and there's certainly the possibility that transmission could occur that way. I'm all for, good parenting, common sense, and data-driven public policy. I'm not a betting person, but I would bet that at least through June, let's put it this way, because things change fast. It's May, at least through June, and I'd even speculate at least through July. I bet there's no summer camps. That's my guess. That's my guess. And I'm not basing this on any inside information. I'm just based on where we're at and what we know. That'd be my best guess for now.
So Sweden took a completely different approach. What is your take on Sweden's approach?
I mean, this boils down to value judgments. Sweden's getting pummeled, right? Their death rate, when you compare it to, comparable neighboring countries, is significantly worse. And, people have sort of been cherry picking data points that suit their personal beliefs and using them. I guess I should expand that. That's not just with Sweden, that's with everything. But especially with Sweden, that's happening. And listen, I don't feel like I have a dog in this fight. You just want health and well-being for everybody. But if you take a step back and look at the 30,000 foot view, their deaths are significantly worse than comparable neighboring countries. They did clamp down. People keep saying they did not have public health measures. Of course they did. They had significant public health measures. They weren't as stringent as other places, but they certainly did have some pretty significant public health measures. A lot of this boils down to value judgments. And I'm not saying what they did is okay or not okay. It's that's not even fair because there was a lot of disagreement within the country, but the leadership in the country felt that perhaps that they were able to balance, some freedoms and some normalcy, and they had these death rates that they had, and again, I'm not saying it's right or wrong. No, it's not true. I don't agree with that approach. I will say in my opinion, it's wrong, but those are my value judgments. I don't have to impose them on people from Sweden. But their beliefs was that was the right approach. I don't think it was the right approach. And my value judgment is that that's an unacceptable high number of deaths that probably could have been prevented.
I'm glad that you spoke to that because it's been cited in many articles and in many different ways that Sweden has been, their model has been better. And I appreciate you speaking to that because there's been a lot of confusion around the various countries, and Sweden keeps coming up in conversation. Yeah. So I think that's amazing that you spoke to that. What do you think about the idea that Health Canada today okayed an antibody test?
Oh, it's fantastic. I mean, I think they got it right. We saw what happened in the United States about, a month and a half, 2 months ago. The FDA, the regulatory body of the United States, really relaxed some of the regulatory, processes and allowed a lot of these antibody tests into the United States. Look what happened. Many of these antibody tests were in the United States, and many of them were of dubious quality. And that was a huge problem, and actually it was such a problem that many public health bodies within the United States said, "Stop! Don't use these tests. They are not interpretable. We don't know what a positive result means. We don't know what a negative result means." And Canada appropriately dragged its heels. We said, you know what? We don't know what's going on. Let's just push pause. Let's wait for a strong horse to emerge. And when one does, we'll give it the green light. And that's what they did. And, out of this mess, it looked like there's a couple of good tests and Canada, approved one of them. And I think now we have to figure out at the provincial level, how are these going to be used? What surveillance systems are we going to put in place? How are we going to screen communities? How are we going to look at serology over time? I think is the other interesting thing. And then at an individual level, are you going to be providing individual counseling based on this? I mean, we can learn a lot because we still don't know if people have recovered from the infection. We're not sure to what extent people are immune and for how long they're immune for. And those are two big questions that need to be answered. These serologic tests will be very helpful tools in answering some of those questions.
How long do you see actual testing, not antibody testing, but actual COVID-19 testing go on at the level that it is right now?
I think we need to scale up. I don't think we're at the level that we need to be.
Okay.
Certainly we're doing much better across the country, but there should be in a perfect world, there should be no barriers to diagnostic testing. I think we should scale up on surveillance in different communities and screen asymptomatic people periodically just to see if there's, an ember that's glowing, we can catch it before it turns into a flame. I think we should be, and we're doing that in long-term care facilities, but we can expand into the general community, especially other high-risk areas.
Really?
Yeah.
Wow.
And
That's
I think
amazing.
that, you still hear stories of people going to COVID-19 testing centers and getting turned away because they don't meet whatever criteria that they have, which is, I think, unacceptable as of, May 13th, 2020. So we really need to lower the barriers to diagnostic testing and scale up. And certainly we've got to find these cases before they, start a chain of transmission in the community and set us back. So it's extremely important to
How do we do that?
Testing. So a couple of things. One, you need laboratory capacity, which is pretty good in much of the country, but still could be improved. Number two, you need to have the capacity to have rapid turnaround time. It's not acceptable to give someone an answer back, 4 or 5 days later. You really want to have rapid turnaround time. And then, of course, you need an army of contact tracers. You really need a lot of people who can not just identify the positive case, but do the contact tracing to look at anyone who had a significant exposure to that case, and then support people through a 14-day period of isolation. And that way, we would be, better prepared to prevent a second wave of infection.
What is it, before I let you go, what is it that you want Canadians or people to know right now about COVID-19 and its spread and how we're doing?
I think it's important to know that, we'd be foolish to think that we have all the answers. I think it's important to parlay that we still need to be patient for a vaccine. Good science takes time. It's going to be faster than most vaccines, I'm guessing, but it's still going to take time. It's okay for public policy to change as it adapts to new knowledge. And as we learn more about this virus and where it's spreading and how it's spreading, it's completely acceptable for senior health leadership to change public health policy to keep up. That doesn't mean people are flipping or flopping. It means they're adapting to new knowledge. That's a good thing. I mean, it's important. And, I think if we can do our best to really have reputable sources of information and not politicize this and just really all look into getting this under control to make sure Canadians are safe, then we'll be headed in the right direction.
I appreciate you speaking with me today. I know how busy you are and how busy you've been, and hopefully the next couple of weeks things start to settle a little bit for you. Hopefully, fingers crossed. We'll see.
Yeah.
But I really do appreciate it, Dr. Bogoch. Thank you for your time today. Stay healthy. Thank you.
Thanks for chatting. Have a good one.
Thank you. Take care.
Bye-bye.